Hi, I'm Phillip Scheinberg from São Paulo, Brazil, and we're here at the 11th edition of SOHO, Annual Meeting for the Society of Hematologic Oncology. And we had the opportunity to look at the myeloid neoplasia sessions that have been going on so far, and they've been terrific, especially myelodysplastic syndromes. There's been a lot of focus on classifications and mutations. They're coming with a lot of force. So more and more we're applying this technology to better risk stratify our patients, and we have seen examples, and which was shown in the sessions, of patients who are upstaged based on their mutational profile. So a lot of talks about the different classifications as we moved from one to the other, and the more recent incorporation of molecular data to the better understanding of the biology of myelodysplastic syndromes. A lot of new therapies and options, specifically in the lower risk space. So luspatercept is a very interesting a drug that has been developed for a particular type for MDS with ring sideroblast, but now it's been applied to more patients that are requiring transfusions or are anemic. And the data comparing it to erythropoietin was very exciting, very recent, and we had the opportunity to hear from the authors and the people who participated in the trials to discuss them, present it to the audience. So that was very exciting. Also, other strategies with imetelstat, an anti-telomerase drug approach that is not yet approved. They're available, but hopefully that will change this year or next year, opening the options for lower risk MDS patients. Unfortunately, in the space of the higher risk MDS, in terms of therapeutics, we haven't seen a lot happening, a lot of attempts, a lot of promising phase 2 data that didn't really confirm in phase 3 randomized trials to be actually better than hypomethylating agents alone. So again, we're a little bit put down by that, but again, have to keep going. And trying different combinations and new therapies and new approaches. So hopefully for SOHO in the next year or two, we'll see also more therapeutic options in the higher risk MDS space. We're still dealing with transplantation as a principal mode of therapy for those patients who are eligible to bone marrow allogeneic stem cell transplantation. And here the molecular data has been also very, very helpful. The target approaches that have been applied to AML have also been now being explored in MDS, especially when they carry these mutations. Again, in isolation, not a lot of MDS patients carry these mutations, but if you were to add all of the possibility of mutations and targetable mutations that are druggable, we're talking maybe about 15 to 20% of patients. So this was all debated, this was all presented and discussed. So it was a very, very rich session, very interactive, a lot of new information, really, really up to date, which was really enriching for those of us who were in the audience participating and learning from all the experts that had the opportunity to share their own experience, a lot of times their own data to us. The room was packed, so that was very, very exciting to see, and we're hoping for SOHO for the next couple of years that we'll continue to see these novel therapies being incorporated into practice, not only in lower risk MDS, but also for higher risk MDS patients. So again, another home run for SOHO this year, especially for the myelodysplastic syndromes and all other sessions that we've seen so far. So hopefully to be able to bring you more information in the next few years that is brought to this meeting that can be presented to you either in person or virtually or on demand after the meeting is completed. Till next year.